Hello, everybody. It's Mrs. Bartels. I'm going to do Chapter 26, Taped Lecture. Chapter 26 starts on page 384, and it goes to page 394. It is part of the quiz that you will take on Wednesday at home. You'll have a quiz on Wednesday for Chapter 22 and 26. And this chapter is about collecting specimens. So I'm in my class. I'm going to go over to materials. I'm going to scroll down to module 3. Okay, and I'm going to find what is 22 and 26. Click on that because that's the chapters. And I'm going to find what is the assignment for Tuesday the 19th. Is to read chapter 26, textbook pages 384 to 394, review all 16 PowerPoint slides, listen to the taped lecture, which I'm doing now with you, and finish working on your homework. Your quiz is on Wednesday, and your homework is due Thursday. Okay, so I'm going to go over to the slides here on chapter 26. So when we're talking about specimens, we can have different types of specimens. You can have a urine specimen where somebody urinates for you. You can have a stool specimen where you collect their bowel movements. We could have like a wound specimen, so maybe some drainage from the wounds. And we could also have what we call a sputum specimen, which is usually when somebody has to spit up something and it's a product. The sputum actually comes from the lung. It's not from the back of the throat, it's from the lung. So we're going to talk about how do we collect specimens and the different types of specimens that we do. All right, so I'm going to go over here. So collecting specimens. So specimens are samples, okay? It's like if you go to a doctor and they hand you a cup and they say, I need you to give me some urine in this cup. Okay, so it's a sample. They're samples that are collected and tested to prevent, detect, and treat disease. So we can collect them like right now we're doing COVID swabs. Like if you're going to clinical, you have to go and get a COVID test done. So what they do is they take a little specimen, they take a swab and put it up in your nose, okay? Swirl it around, and then they send that specimen off to the lab, and they're checking to make sure to detect that we do not have COVID. And if we do have COVID, then they're going to call us, and we're going to find out, and we're going to have to treat the COVID, okay? And we also do it to prevent things. So the same concept, we're doing our COVID screening and our swabs, so we prevent bringing COVID into a nursing home. So there is a good example of it. The doctor orders what specimens to collect and what tests to run. So he might say get a urine specimen on the patient. That's not enough information. We need to know what kind of urine test is he going to run. So he would say, I want you to collect the urine for a urine drug test. Okay, so now I know I need to get urine, and I know that I'm getting that urine for a drug test. Because if you just ask a person, hi, can you pee in this cup? They're going to want to know why. So we have to say the doctor wants to check your pee to see if you maybe have blood in it. He wants to see if you have some sugar in it. He wants to see if you have bacteria in it and you have an infection. He wants to run a urine drug test to see if there's any drugs in your system. Okay, so the doctor orders what type of drug or what type of specimen to get: urine, stool, sputum, wound, and he tells us what we're testing it for. All specimens are sent to a laboratory. So after we get the specimen from the patient, we label it and we send it to the laboratory. When we send it down to the lab, it has to have a label on it. It also has to have a slip of paper called a requisition, and that tells the lab what they're supposed to do with this urine. So the requisition will say what the doctor wanted the urine for and what tests they're supposed to run. So if you take a cup of urine down to the lab, you don't bring the requisition or the slip with you, the lab has no idea what to do with that urine, and they usually just throw it out. And now it's wasted. So make sure if you're ever bringing something to a laboratory for any kind of specimen, make sure you always have it labeled. We're going to talk about that in a minute. And you have the requisition with you so the lab knows what to do with the specimen. All right, so when we collect the specimen, and this is on page 385 of your book, in the blue box 26.1, talking about collecting specimens. When you collect a specimen, you open up the cup, which I'm so sorry, that's so rude. You never touch the inside of the container or the lid. So when I go to open the cup, I'm going to unscrew the lid on the outside. I never touch the inside of the lid, and I never touch the inside of the container. You have to keep those clean. All that should be on the inside of the container is the person's specimen. Don't put your hands on it because then it's contaminated. You also need to label the container before the person goes in it, before they give you a specimen. So you're going to tell them, my name is Lori, I'm your CNA, and the nurse asked me to collect some urine from you to see if you have an infection. So I'm going to need you to pee in this cup. Okay, before you pee in the cup, though, I want you to label the cup in front of you. And the label has your name. Is this your name? And you ask the patient their name. Is this your date of birth? And you ask the patient their date of birth. Is this your room number? And they confirm yes. Okay, and then you put that label on the container and you use that to put the specimen in. Collect the specimen if it has a specific time, like if the doctor says he needs it at 7 a.m., we have to get it at 7 a.m. Some tests have to be done at certain times, and a nurse will let you know how that is and what time you need to do it. And make sure that you tell the person they cannot put toilet paper or facial tissue in the container with the specimen. Okay, so if they're going to do like a urine specimen, you don't want the toilet paper put into the container. You just want the urine. So if you look on page 385 of your book and the bullet points under box 26.1, make sure you understand number 5 bullet point that you don't touch the inside of the container. The 7th one, that you label the container in the presence of the person. In front of the person, you label it. The 8th one, if there's a certain time it has to be collected at the correct time. And then if you go, the 12th one, have the person put the toilet paper in the toilet or the wastebasket, never in with your specimen. Okay, so those are ones that you're going to see on your test. So first specimen we're going to talk about is a urine specimen. So the urine specimen, as you can see as we go through slides, can be collected. There's different kinds of urine. So we could collect a urine for random urine. That's this slide. We could collect it for a midstream urine. That's that slide. And we could collect it for a 24-hour urine. Okay, so those are the different, and also for ketones and blood. So we're going to talk about the different types of urine tests that we can do. So the first one's pretty simple. The first one's called a random urine specimen. Random, if you don't know what that word means anytime there's no specific direction, just give me pee in a cup. Okay, so random urine specimen is collected if we're just trying to do a spot check on somebody's urine. Okay, maybe you go to the doctor and you're like, I'm here because every time I pee and I wipe, I have a little bit of blood. And he'll be like, whoa, okay, can you go to the bathroom now and give me a little bit of urine specimen? He's just going to check what's going on. So there's no special instructions. There's no special thing you need to do. It's like you basically tell the person, we need some urine. Can you pee in this cup? Okay. It can be done any time of day. There's no specific directions besides telling the person, hey, don't touch the inside of the container and pee in the cup for me. Okay. It can be done at 9 o'clock in the morning. It can be done at 9 o'clock at night. It does not matter. So it's random, meaning there's no specific directions or instructions. We just need you to pee in this cup. Spot checks for drug tests. Like if a person's maybe on parole or a person's been in trouble, or maybe you're at work because they do drug tests, nurses and police officers all the time. If they walk in and you're on duty and they say, I need you to pee in this cup, and you say, why? And you're like, because we're doing a drug test, you have to do it. Okay. If you don't do it, they consider you guilty. So that's a good example. People could just show up and say, I need you to pee in this cup. It's random. You're not expecting it, but hey, can you do it for us? Many people, meaning the patients, can do this specimen collection themselves. You hand them the cup, you instruct them, don't touch the inside of the cup. Okay. And I want you to go in the bathroom, and when you pee, I want you to pee inside the cup, and then put the lid on it, and I'll come get it. That's all you need to do. If somebody's really weak or very sick, you may need to help them get the specimen, but usually most people can do it on their own. So that's a random. Okay, the next one's called midstream. So make sure in your book on page 385, where it talks about random, underline or highlight the random urine specimens used for routine UA. No special measures are needed. Is collected anytime in a 24-hour period. Okay, now we're going to go on to midstream. Midstream is a little more difficult because it has specific directions or instructions. And what happens if you look at the word midstream, this urine is going to be collected in the middle of the person urinating. So basically what you do is you tell your person, I need to get a clean urine on you. So what I want you to do is I want you to go in the bathroom and with this wipe, it's like a handy wipe, I want you to clean from front to back. You want them to give peri-care to themselves. Okay, so before they even give you the specimen, they got to clean their peri area. And you tell them, after you clean your peri area from front to back, I need you to start urinating in the toilet. Then I need you to stop, place the cup, and collect some urine in the cup. Stop again, finish urinating in the toilet, and then put the lid on the cup and I'll come get it. Okay, so let's go over that again. You tell the person, clean yourself from front to back using the wipes. I want you to do good peri-care. Then I want you to start voiding. I want you to start to go to the bathroom and the toilet. So you want them to pee on the toilet, and you tell them, and once you pee a little bit, I want you to stop. I want you to place the cup, pee in the cup, stop again, and finish peeing in the toilets. So see how it's a midstream? They started going, you stop in the middle of the stream, you put the cup, and then you tell them to go in the cup. Then they stop again and finish in the toilet. Okay? So here what it says. The person starts to void in a receptacle, meaning in a toilet. Then the person stops the stream. So they stop peeing. The sterile container is put into place, and they urinate into the container until the specimen is obtained. The thing with this is if somebody's weak or young or very old, they might not understand these specific instructions. So you're going to have to be in there and do it with them. You might have to hold the specimen cup. You might have to do the peri-care if they're not able to do it. Okay? It has to be done this way because it's a clean catch. We don't want dead skin cells or like tissue or mucus or sweat that was in their peri area in the specimen. We want to get a good, clean urine. So we have to make sure we clean them and they don't touch the cup. And that's a midstream. So here's an example of it. It's kind of like, whoa, Ms. Bartels, I know. And basically what's happening is the person is positioned and the gloved hand is not contaminated. Okay, so the person is holding open the labia and helping the person pee into the cup because they were unable to do it. Okay, so if you look, what this picture is saying is this hand is not contaminated because it's holding the cup. This hand is contaminated because it's holding open the labia. So this hand is a dirty hand. This hand is a clean hand. The cup is in the clean hand. Okay, let's get rid of this picture. Sorry. So in your book about the midstream urine, you want to, it's on page 387, I would highlight a midstream urine is also called a clean void or a clean catch because we clean and then we catch the urine. The peri area is cleaned first to reduce the number of microbes in the urethral area. The person starts to void into a device, then the person stops the urine stream and a sterile container is put in place to catch the urine. The person voids into that container until the specimen is obtained. And then he goes on to say, stopping and starting the urine stream is hard for many people. You may need to position and hold the specimen container after the person starts to void. So you might have to get in there with gloved hands and help them do this the right way. In the red box on page 387, it says focus on communication. Some people can collect their midstream urine without help. To explain the procedure, use words the person understands. Show them the supplies and how to use them. Also ask them the person the questions, make sure they understand. So you can't say, I want you to go in there and do peri-care. A normal person doesn't know what peri-care means. So you're going to have to say, I want you to go in there, open up this bag, and inside you'll see this wipe. With this wipe, I want you to open it, and I want you to clean your private area from the front to back. Don't come back to the front. Just go, or don't don't go up and down. Just go front to back, front to back. Okay, so you have to explain what peri-care is to them. So there's an example. Miss Jacobs, I need a midstream urine specimen for you. This means I need your urine from the middle of your urine stream. First, wipe well with the towelette from the front to back. The specimen will go in this cup. Please do not touch the inside of the cup. I need you to start urinating, then I need you to stop, then position the cup and catch the urine into the cup. Okay. I need at least this much, and you show them how much, you point to it, to get a good specimen. And then when you're done, remove the cup. When it's about half full, finish urinating into the toilet, put the lid on the cup, and I will collect it. Okay, so the red box there, make sure you know what that says and how you communicate to a person how to do midstream. Okay, the next one that we're going on to about urine is a 24-hour, hold on, he's right there. A 24-hour urine specimen. So again, if you just look at the name of it, 24 hours, that means I'm going to collect all the urine somebody does in 24 hours. So if they pee at 8 o'clock in the morning, I'm going to collect the 8 o'clock urine and I'm going to put it in a jug. If they pee at 10 o'clock, I'm going to add that 10 o'clock urine to there. If they pee at midnight, noon, I'm going to put that urine into the jug again. I'm going to keep collecting all the urine. So throughout the day, the whole 24 hours, I am going to collect the urine. So with this one, we have to know what time are we going to start the collection and what time do we end the collection, because we have to make sure our patient understands. So if we're going to start it at 8 a.m., we would go in there and say, Mr. Smith, we're going to start a urine specimen on you. We're going to collect it for the whole 24 hours. This means that I need you to try to void now. It's 8 a.m. He gets up and he voids that first urine. The first time he goes, you discard it, meaning you flush it. It does not go in the container. And then every time after that he goes in the next 24 hours, you save it and put it in the container. So if we started at 8 a.m. on a Tuesday, we're going to end it at 8 a.m. on a Wednesday. When you go to end it, you have to go and ask the person before the time ends, like at 7:45, you're going to go in there and say, Mr. Smith, we're almost done collecting your 24 hours worth of urine. Can you please try to go to the bathroom one more time? And then you add that to the urine. Okay. If the jug is about 2 liters, it can hold 2 liters of urine. If he pees a lot and you need a second jug, you just ask the lab to send you a second jug and you just keep collecting. You fill the first one, then you start filling the second one. The jugs, they're orange jugs. They kind of look like brown orange juice plastic containers. I don't know. I'll show you a picture in a minute. So the jugs have to be labeled because that's what the specimen is in. And sometimes we have to keep them on ice. So we might have to get a bucket of ice and sit the urine on ice to keep it cold so it doesn't start growing any bacteria infection. The nurse will give you those directions. Okay, so with a 24-hour urine, it's very important that you understand that the first urine is wasted. And then you collect all the urine after that. Okay, so 24-hour urine on page 388. All urine voiding during the 24 hours is collected for a 24-hour urine specimen. To prevent microgrowth, the urine is chilled on ice or refrigerated. If for some reason you're in the middle of doing this 24-hour urine and say you start at 8 and then it's 9 o'clock, he goes again, and then maybe 11 o'clock you go to lunch and your person that's covering you forgets and flushes the urine that maybe the person puts the call on, you're at lunch from 11 to 12 and somebody else is watching your patients. At 11:30, your patient puts the call light on, he says he has to use the urinal, and the person that's taking care of your patients gives them the urinal, and then she empties the urinal into the toilet. Because she didn't save the urine and you're in the middle of a 24-hour urine, you have to start all over. Everything is a waste now. So you usually have to start the next morning. So you have to explain to the doctor, explain to the nurse, explain to the doctor, explain to the patient, I'm sorry, the collection was interrupted. It wasn't done the right way. We have to start all over tomorrow. So you want to make sure you understand what you need to do. You don't want to mess up this urine specimen. 24 hours is a long time. So make sure you follow the directions on it. Okay. The next one, hold on right quick. I'll show you a 24-hour urine drug at the end. Okay. The next one is just what we call dipsticks. So you can see the picture on page 389, figure 26.3. What happens is a person urinates in a cup, and then a nurse can take a stick and dip it in the urine. And when she dips it in the urine, the stick will start changing colors, and then she can compare the colors to the bottle and see if the patient has blood or bacteria or what's going on. So that is called pH testing or strip testing. Okay, so testing for pH, we're looking to see how much acid and how much base is in somebody's urine. All that we do is tell the person, I want you to pee in this cup. And they pee in the cup, and then the nurse will put gloves on, put the dipstick inside there, and it's going to tell us how much acid or how much base, what's the balance of his urine. Okay, if it's too much acids, he might have an infection. If it's too much base, he might be overhydrated. Another one that we can do is we can test for blood. So again, I can tell a person, hey, I need you to pee in this cup. They pee in the cup. I put a dipstick or testing strip into the cup. I pull it out, and it will change the color if there's blood in the urine. Okay. And that's really important because hematuria is blood in the urine, but sometimes we have what we call cult blood. So I might tell you, hey, I need you to pee in this cup because the doctor wants to test you for blood in your urine. And you'll be like, my urine doesn't have blood. It's yellow. Look at it. You're crazy. You and the doctor are crazy. And you explain to the patient, I understand, but we have to run the test because sometimes blood isn't always red. It could be what we call cults. It could be in there, but not presenting as red. Okay, so it could be tiny, tiny little amounts of blood. It doesn't make the urine turn red. We may not even see it with our naked eye. So that's called occult's blood. Okay, occult, meaning it's unseen. It's kind of private and hidden like occults. So you might take a urine specimen, okay, and it looks perfectly yellow. It looks like a normal color. You put a dipstick in it or a test strip in it, and it comes back positive for blood. You're like, whoa, that's occult blood, meaning the urine wasn't red. You didn't see blood in the urine, but when you tested it, it was there, unseen blood. Okay. And the other thing we can do is testing for glyceria and ketones. Gluco means sugar, and urea means urine. So we're testing to see if a person has sugar in their urine. We do this for diabetics, and we're also testing for ketones. So when a person's diabetic, if they have sugar in their urine or they're spilling ketones, meaning I test her urine, it's positive for ketones, that is a sign that their diabetes is not in control and they're in danger. Okay, so it says diabetic person may have glucose or ketones. Ketones appear in the urine when fat is being broken down for sugar. Our body should not be breaking down fat. It should be breaking down carbs. So something's going wrong when this happens. So somebody has ketone in their urine, meaning we test the urine and we put the strip in there and it comes back positive for ketone or sugar, glucose. That means that person is not controlled. Something's going on with their diabetes. Okay. When we test for ketones, you need to know this. We test 4 times a day. We do it a half hour before the meals and at bedtime. So if breakfast is 8 o'clock, we're going to test them for ketones at 7:30. If lunch is at noon, we're going to test them for ketones at 11:30. If dinner's at 4, we're going to test them for ketones at 3:30. And then if they go to bed at 9 o'clock, we're going to test them for ketones at 8:30. Okay, so 4 times a day, 30 minutes before meals and before bed and at bedtime. The reason why we do this is this gives the doctor a good idea if the person's sugars are in control, the diabetic medicine's working. And if it's not, the doctor can change the drugs around that the person's taking or change his diet so we can get the blood sugar in better control and help that diabetic. So those are ketones. So in your book, make sure you know what hematuria means and make sure you know what occult blood means. And those are on page 389 in the second bullet point under testing urine. Know what it means when we test for ketones, the third bullet point. So if you go further down on that bullet point, it says ketones are substances appearing in urine when rapid breakdown of fat is used for energy. Okay. The body is using the fat because it doesn't have sugar. Tests for glucose and ketones usually are done 4 times a day. Make sure you know they are done 4 times a day, 30 minutes before meals and at bedtime. It's on your test. Okay. And then the reason why we do it is it can help the doctor decide what drugs or diet changes need to be made. Okay. So on page 389 in the blue box, it talks about delegation guidelines. So if you're going to test urine on somebody, you need to know some things from the nurse. You need to know, what am I testing it for? What equipment do I need to do this test? What time should I do the test? And you should know without having her to tell you, if you're going to be touching urine, you have to follow standard precautions. So you're going to have gloves on and be careful because you're touching body fluid. The nurse does not need to tell you that. You should know that. It's just common sense. If you're going to touch somebody's urine, you're going to wash your hands and put gloves on before you do it. Okay, but the other things that the nurse has to tell you, she has to tell you, what kind of tests are you doing, what equipment you use, and what time does she want the specimen. That's in the blue box on page 389. All right. Now we're going to go on, and this is just talking about reagent strips. And that's what I just said. You need to know what test, what equipment, and when to test. So when we just did. Okay, we're going to go on and talk about poop specimens or stool. Stool is another word for poop. So stool specimen starts on page 390 of your book. Stools are checked and studied for blood. So we're checking to see if somebody has blood in their stool, which they shouldn't. Do they have fat in their stool? Because that's something going on with their liver or their pancreas sometimes. Do they have microbes, meaning germs, in their stool? Do they have worms or abnormal contents? I've seen worms in stool before. Microbes like C. diff, rotavirus, kind of viruses that you can carry. We've seen that before. Campylobacter, there's all kinds of stuff that the stool can carry that's infectious. Okay, so stool specimen, when you want a patient to give you a stool specimen, they cannot urinate. So they need, if you have to get a stool specimen from somebody, you might want to tell them, I need you to go to the bathroom. If you feel like you have to urinate first, and then we're going to work on getting the specimen for stool. Okay, they cannot be mixed. You cannot have urine in your stool specimen. You cannot send it to the lab that way. You can't pick the stool out of the urine. So you have to try to get the person to urinate before you collect the specimen. And they cannot be mixed together. Okay. So the person uses one receptacle for voiding and another one for vomit. So they sit on the toilet. We could put what we call specie hats. They look like little top hats. So you could put one in the front half of the toilet to catch the urine and one in the back half to catch the stool. Okay. So when they go to the bathroom, if they're going to pee, the pee goes in the front one and the poop goes in the back one. You use a tongue blade to take out 2 tablespoons of stool from the cup. So if the person goes into the bedpan or in the receptacle, the specie hat in the toilet, and it's caught, you don't use your fingers to take that stool specimen and put it in a cup. You're going to use gloved hands and use what looks like a kind of a tongue blade, but it's got a scoop like a spoon. It looks like a flat spoon. And you're going to get 2 scoops for that and put it in your cup. And when you get those 2 scoops, you're going to do a scoop from like maybe the middle of the stool and maybe a scoop from the end of the stool. Don't take it from the same spots. So you take 1 tablespoon from the middle and 1 from the ends. Don't take the 2 tablespoons from the same area. Okay. And then you have to ask the nurse when you're getting a stool specimen, when I'm done getting it, does it have to be refrigerated? Does it have to be kept at room temperature? Because some of them have to be put on ice. Some can be at room temperature. Some have to sit in a refrigerator until the lab person can come get it or you have time to take it down to the lab. Like in a nursing home, they don't have labs. So if you're going to work in a nursing home and you have to collect specimens, you have to ask the nurse, well, after I get it, where do you want me to put it? Do you want me to put it in a refrigerator? Can it sit out? Because there's no lab in the nursing home. You got to wait until the lab, the little carrier guy comes and picks it up and takes it back to the lab for you. So if it's supposed to be refrigerated and you leave it out, it's not going to work. You got to know. Okay. The specimen is taken at once to the laboratory or to the storage area for transport to the laboratory. So if you work in a hospital and you get a specimen, you take it immediately to the lab. If you work somewhere where they don't have a lab, you need to put it into the area where you're supposed to store it until it's picked up and taken to the lab. So you might have to call the lab and say, we have a specimen. Can you please send somebody to come get it? Okay. Okay, so let's look at our book about stool specimens really quick. On page 391 in the procedure box, It says number 20, collect the specimen. Use a tongue blade to take about 2 tablespoons of the stool from the container. Take a sample from the middle of the stool, and then take your second sample from any areas of pus, mucus, or blood, if there's any of that, or watery area. Or you could take a stool from the middle and both ends. Make sure you understand, after you use that tongue blade to get the stool, that tongue blade does not go in the garbage until you wrap it in a paper towel. So wrap it in paper towel or Kleenex, and then you throw out the tongue blade. Okay, so that is number 20 on page 391 and number 21. Okay, there's a test question from this to make sure you know it. How to collect that stool, what do you use to collect it, and what do you do with it when you're done with it? Okay. If you look on your page in 392, there's an example of what I'm talking about when they say they could put a receptacle in the back part of the toilet. It looks like a half circle. It takes up like half the toilet. So it's called a SpeciPat or a SpeciPan. So you put it in the toilet. If you put it in the back of the toilet, you're trying to catch a stool specimen. If you sit it in the front of the toilet, you're trying to catch the urine. Okay, so this one's set up to catch a stool specimen because it's sitting in the back of the toilet. So when the person poops, they will poop right into it. And then you can use that to get your specimen with the 2 tablespoons and a tongue depressor. If they can't get on the toilet, you do it in a bedpan. And you take the stool from a bedpan like it shows on your slide right now. Okay, we're going to go on to sputum. Sputum specimens. Make sure you know what a sputum is. A sputum is mucus from the respiratory system that's excoriated or expelled through the mouth. So it comes from the respiratory system, meaning it comes from where your lungs are. A sputum doesn't come from the back of the throat like you maybe have some post-sinus drainage or nasal drainage because you have really bad allergies. So you get like a mucus buildup in your throat. That is not where it comes from. It comes deep down from the lungs. Okay, and it involves the person having to take a really deep breath and cough very hard, like, oh, and then it comes up. Okay, it's not, and it comes up. It's a good, strong cough. Okay, a sputum specimen that's studied for blood, it can be studied for microbes and abnormal cells. So the reason why we do sputum specimens mostly is we're checking to see if the person has blood or abnormal cells. If somebody has abnormal cells, that's a sign that they have cancer. So they'll do sputum specimens if they think somebody might have lung cancer or some kind of cancer in the respiratory system. They'll say, I need you to give me a specimen of your sputum, and then we'll tell the person how to do it. And they're looking to see, is there blood or is there maybe a sign of cancer? Okay, and that's how they figured out that my father-in-law had his cancer. Because they come back with abnormal cells, and then they did a scan and they saw that he had cancer. Okay, sometimes we are also looking for microbes. They can do a sputum specimen to check somebody to see if they have TB. So maybe somebody has the symptoms of TB, like they have night sweats and high fevers and a cough. So they're like, okay, let's do a sputum specimen to see, does this guy have pneumonia or TB? And those are infections. So that's when they do it to test for microbes. Abnormal cells means cancer, and blood in the sputum means hematosis. Make sure you know that. It is on page 392 of your book in the blue box. Hematosis means blood in the sputum. To get a sputum specimen, the person coughs up from the bronchi and the trachea. Okay, so they cough from their lung. It is not the saliva that's in their mouth. It comes up from the lung. The best way to get one is first thing in the morning. So you go in there and you tell the patient, I need you to cough. I need you to sit upright, take a couple deep breaths, and cough really hard and get a specimen from in the middle of your chest. I usually point to chest. I need it from here, from like your breast. I want you to cough so hard that you feel you're coughing up a lung. Is what I usually tell them. Okay. You also do not let them eat or drink anything. That's why it's best to do it first thing in the morning. And you definitely do not let them brush their teeth or use mouthwash, because you want to see if there's any microbes or bacteria or anything in there. So if they brush their teeth or use mouthwash, it won't be an accurate specimen. The other thing too is if they eat or drink, it won't be accurate. So you only let them have a little bit of, if they say I have to have something to drink, they can have some water to rinse their mouth with. Okay, do not let them drink. Do not let them eat and then take that specimen. The first thing you do is first thing in the morning, sit them upright. Tell them if you want to rinse your mouth, you can with water. No mouthwash, water. You cannot brush your teeth. You cannot have anything to eat or drink. But if you need a little bit of water, you could do that to rinse your mouth. Okay? So with a sputum specimen, I went over that quite a few times because it's on your test. Know that it's mucus that comes from the respiratory system, page 392. It's coughed from the bronchi and the trach. It's easiest to do it in the morning. You could have the person rinse with water. It's all on page 392. Mouthwash is not used. Make sure you know that. Okay. And then no, under promoting safety and comfort. Again, this is a very deep, hard cough. It's very unpleasant because you hear, and it's like, oh my God, what's going on in that room? So you want to make sure that you close the door, pull the curtain. If there's a roommate in the room, you might want to take the roommate out of the room so they don't have to hear that unpleasant cough and spit. So you want to make sure you provide for safety and comfort. Read the box on page 392, the green box. Okay, about safety and comfort. Moving on. Here's an example how you do it. Before you obtain a sputum specimen, you have the person rinse their mouth with water. Rinsing decreases the saliva and the food particles. Do not use mouthwash. It destroys the microbes. Provide for privacy. The person may become embarrassed by the procedure. It's not pleasant to look at. It is gross. It is absolutely gross. And the person may make disturbing sounds during the procedure. So you want to make sure that the door is closed, the curtains pulled. And like I said, you want to try to protect them from the privacy. We are done with the chapter. I went through the book as we did, and I told you what to highlight. So I hope you guys did. And again, you'll need to know the different types of urine specimens. You need to know that a random does not have any special instructions. The midstream is one where the person starts peeing, they stop, they place the cup, they have to do pericare before they pee. The 24-hour urine is one where you collect for 24 hours. We talked about what the stool is and what the urine or what the sputum specimen is. I'm going to show you just really quick. Let me end this. Okay. Exit here. Okay. They're there. They're big orange jugs, the 24-hour urine container. That's what they look like. They are big orange jugs that can hold about 3 liters of urine. Again, they come from the lab. You can see they're sealed. See how the red mark has a seal on it? You break the seal and you start putting the urine in there. The first urine of the day does not go in here. It goes in the toilet. Everything else after that for 24 hours goes in here. And you have to remind the person when it's about time to end, Mr. Smith, we're about ready to end. It's been almost 24 hours. Can you go one more time for me? Okay, so that's what the 24-hour urine looks like. And I just want to show you what a specimen label will look like. So here, this is a good example. It will have the name. It will have the patient's medical record number. The dates and the time is very important. You have the date when you got it, the time that you got it, and you say the source is like urine or stool, whatever it is. And then you have the initial that you are the one that collected it. Okay. And then the sticker peels off and goes on the container. When you put it on the container, do not put it on the lid. Put it on the actual container because lids come off and lids can get shuffled around. And if it's on the lid, your lid might land up on somebody else's container. So make sure you understand that when we're going to label it. See how this has a label on the outside of the container? It's not on the lid. It's on the outside of the container. So that's where your label goes, on the outside of the container. When you go to open it, you're going to break the seal, and you're only going to touch the outside of the lid and never touch the inside of the lid or the inside of the cup. Okay. And then let's see if we can find one more. So here's the Espressi hat. Again, it kind of looks like a little top hat upside down. You could put it in the back of the toilet to catch the stool, or you could put it in front of the toilet to catch the urine, just depending on what you're using it for. Okay, we are done, guys.